I guess that's my cue to get started. So I'm going to start 1 minute early to acknowledge we had a lot of early birds here today, earlier today. So welcome, and you're gonna benefit from being here early. My name is Doug Blizzard with Catapult, and happy to have you on this session today. Let me just start with a few admin things. I'll hear you some questions starting here. Yes, we're going to send this will be recorded so you can watch it later. There will be credit for this session, so that will come to you later as well, including if you have any kind of questions, please ask them at any time. Both speakers are more than happy to stop and answer questions. You know, it's interesting that what we're here for today is open enrollment. You know, oh, well, great, open enrollment. But if you think about it, though, if you think about it really, you spent the whole year working on your benefit plans, looking at other options. Maybe you've added lifestyle accounts, or you've added, you know, wellness, or you've added nutritionists, or maybe you've added direct primary care, whatever it might be. It's only going to work if we're successful in getting our employees enrolled in these plans. And so a lot of companies kind of dial in their annual open enrollment. You know, it's like, ugh, you know, because it's also for a lot of employees, it's a year end. We've got all kinds of other things going on. And so we kind of dial it in. And, you know, if you think about in the benefits world, we're fighting status quo. You know, a lot of people are just used to status quo. They're comfortable with status quo. Even though they complain about status quo, they don't always like it. Why do so many people still have landlines and they still get cable from the cable company? And it's just a lot of people are comfortable with status quo. And so I think it's important to really spend a minute thinking about how might we do enrollment differently, better, to get people's attention. So I'm glad we're here to talk about that today. You know, obviously, we thank you all for being members of Catapult. You know, we've been here around for a long time. It's a new name, but we've been here for a long time, 65 years in the HR space. And just happy you're here. We primarily focus on making your workplaces better, more effective, helping to make employees more successful. We've done this for 65 years, and that's really our mission. And just lastly, before I get into the program today, just reminding everyone, you know, we have a full suite of solutions here. That top line there are the membership benefits, as you know, HR, legal advice, surveys, et cetera. But we also offer, and it kind of follows the employee life cycle from pre-employment stuff all the way through training and consulting. So happy to help you as you have HR needs throughout the year. As we have many times in the past, we're calling on our friends from Hub International. Today, Donna Bishop, who's Senior VP, Market Leader and Advisor for Hub. They do a lot of great education events for us, and we're always very, very pleased with what they bring. She's joined today by Martha Barker, who works for Catapult. She's our Benefit Solutions Manager. One of those boxes on that previous slide was benefit administration. Martha's team we're a third-party administrator doing a range of accounts, FSA, HSA, all the acronyms. We ought to call Martha the benefit acronym manager, but FSA, HSA, HRA, QSERA, ICHRA, all those things. And so, again, excited about today's session because I think it's one of those, it's really where everything starts. You do everything right, but if you don't do this part right, then people don't know about it, they don't care about it, they don't enroll in these things. And of course, we know how important benefits are today to attracting and retaining, whether your employees are just starting out or they're like me. And I understand from our economist friend, I'm now considered elderly. So whatever spectrum your employees are on that, this healthcare is a critical need. And so with that, I'm going to turn it over to our speakers. And again, if you have questions, please put it in the chat. I'll be monitoring the chat, and I'll either answer it if I can, or I will butt in and have one of our talented presenters answer it. So again, thank you. And with that, it's yours.
Thank you, everyone. Thank you for joining us. My name is Martha Barker, and I'm really excited to talk to you guys about open enrollment and how to have a good, successful open enrollment period. If you are anything like me, and I have been doing this for 13 years or so, so I've been through 13 open enrollments with hundreds of clients, specifically for the FSAs and the HRAs and the HSAs and the LMNOPs, all of those acronyms. If you're anything like me, your eye probably starts twitching around September. So one of our goals with Donna is to make sure that we alleviate that just a little bit. And that is the reason why we decided to have this webinar. We're going to talk about the pre-renewal strategy and timeline. So what should we be thinking about and considering before the madness begins? What should we do while the madness begins and everything in between? And then also, very importantly, what do we do after the madness is over? Because we know that, we can start planning for open enrollment and that might go well. And then you have a successful open enrollment and that might go well, but it doesn't end there. Like there's still things that need to happen and that we need to do to make sure that that open enrollment season, not only did it have a good start, but it also has a good finish. And so we'll talk about that. We'll get into all those questions. Thank you, Donna, for joining me. I know that you're a wealth of knowledge. And when we were preparing, for the webinar, I asked her, I don't know, 102 questions, maybe, Donna. we brought it down to 10. We brought it down to 10. So we'll start with the pre-renewal strategy and timeline. Donna, you've been doing this for quite some time. So let's just kind of unpack what an employee should or an employer should do before the open enrollment season even begins. So tell us, how soon should employers begin planning?
Great question. And thank you, Catapult, for having us on the webinar today. Delighted to be able to share the information that we've accumulated all these years of working in the benefits business. So thank you for that. As far as the pre-renewal strategy and timeline, you should start thinking about open enrollment for the following year as soon as that enrollment is put to bed. So what I mean by that is think about what went well and what didn't go well. Were there things that could have been planned a little differently or more effectively that would have increased a better engagement with the employees, a better outcome in terms of enrollments, understandings about the benefits, anything like that? So if there are things that are in your mind as you're coming right off the heels of that enrollment, they're kind of nagging at you, or you thought they went really well, make notes of that and let your broker know, hey, we really liked how this happened, but we didn't really love how this happened. So that can include everything from communication, pre-open enrollment. It can include the plans that were actually offered. It can include the actual enrollment experience, so technology. And I know we'll talk a little bit about that later in the conversation, but it can include a lot of different components. So if there's something that just didn't fit or sit quite right with you about that open enrollment, make a note of that and make sure that your broker knows what went well and what didn't go so well. And in terms of actual planning, you really want to start looking at what you're doing. Is it working? Are your employees enjoying it? Are you getting good feedback? If you have implemented any new programs around wellness or lifestyle accounts or any of those things, what's the feedback? Is it positive? Is it negative? I know that most of you would agree if you're not hearing feedback, it's probably okay. If it isn't okay, you're definitely getting some feedback. So make notes of what your employees are saying. And you may even want to do a benefits survey mid-year just to kind of capture what the sentiment is, if anybody has used any of those programs that you've worked hard to implement and the company is paying for. Yeah. So I would say at about 6 months out, really start kind of diving into that to gather that intelligence internally.
Okay. And so what do you think are some other things that employers should keep in mind while planning? So I know you said, survey your employees, see what's working, what's not working. What are other things that you think could be beneficial while on that pre-planning period?
It's important to know, especially in this competitive environment for employees, really important to know where you benchmark against your competitors. So most brokerages do have access to tools and resources that will allow you to see where you stack up. And Catapult Survey is a great opportunity to kind of look and see where you might compare to your competitors in the market. So if you're at benchmark, great. If you are not at benchmark, strategically, is there a reason why? So we had an executive that was with Hub for a long time that we knew and loved very dearly, who used to say that employers either do things to their employees or they do things for their employees. So you have to figure out what your strategy is. Are you really trying to be competitive? Are you just offering employee benefits because you have to, based on the ACA requirement to? So really analyze what your goals are and know what your goals are and how do you get there. So if your plan is not at benchmark, what do you need to do? What tweaks do you need to make in the next year to bring it up to benchmark to be more competitive?
Yeah, good. Good point. It's important to know where you stand before you know where you're going. So it's important to have a good idea of what you're offering right now and how that's being measured against your competitors to make sure that not only you attract new employees, but you keep the ones that you currently have, especially in this market, right? So
Yes.
let's talk a little bit about the open enrollment meeting preparation. I know that there's kind of two sides of the coin, right? You have the broker, or at least we hope that you have a good broker that's going to help you along the way, and they have some responsibilities, but us as the employers, we have responsibilities as well. So let's say that's the other side of the coin. So let's talk about the broker just for a minute. What do you think are the responsibilities of a broker, for their clients?
So that's a great question. And it's really going to vary greatly on who you're working with, obviously. At a minimum, your broker should be presenting with you with options depending on how your renewal turned out. So if your renewal is excessively high, your broker should be able to go back and potentially negotiate that down for you. Sometimes the carriers will provide what we call a no-shop offer, meaning that if your broker goes back and say, hey, they would like to stay with you, but they need you to come down off this renewal a little bit. At times, there are carriers who will work with us on that. It's really important to say, though, that if you do take advantage of a no-shop offer, please don't ask your broker to go and quote it with another carrier, because we feel like that is a question of integrity. And that is it's a relationship that we value and trust with our clients, but also value and trust with the carriers. So we don't ever like to go back and try to renegotiate over the top of that. So you just want to make sure that your broker is bringing you some options if your renewal was unacceptable to you, or if you've had some negative feedback about the network or the claims adjudication or anything like that from your employees, you'll want to look at other options. And regarding that, I would say that don't just automatically shop other options every single year. If you know that you like a carrier and you have a really good renewal, renew as is. I mean, that's just kind of a good practice to do. It saves a lot of time, where if you're asking your broker to go back and shop a couple of different carriers for other options, when you're sitting on a great option as it is, you're just asking them to spend time and their teams to spend time, and you spend time to review what they bring forward next. Right. So if you're happy with the renewal, renew as is.
Mm-hmm. Yeah, sometimes we think that it's kind of like when we go to the grocery store, right, to buy cheese, and it's like, oh, I can get $1 cheaper at Target. So you go to Target, but you're really spending time going to Target, like you spend time and gas and energy. So sometimes it's okay to say, hey, this is pretty good. Let me go ahead and take it as is. Of course, we all know that there are some times where the carriers will have an astronomical increase for premiums, and then at that point it's like, yeah, shop around. But if you feel comfortable, if you feel comfortable with your broker, and brokers are always going to be looking out for the best interest of their clients, I think that's obviously their job. That's how they keep their jobs, right? They want to make sure that they're taking care of their needs. They're always going to be looking out for you, or at least a really good broker should be. And of course, by experience, we know that Hub does really, really well. So we talked a little bit about brokers. Let's talk about the responsibility of the employer, because sometimes we want to say like, oh, I didn't see anything, I didn't hear anything, I'm just going to let my broker take care of everything. But what is the responsibility for the employer, the HR director, the benefits manager? What should they be thinking, and what are their responsibilities?
They should really think about the calendar in terms of getting the decisions made about what plans they'd like to go with. So the broker will bring the options. If they're not going back to shop other options, try to make your decisions based on what your goals and your budget are, and then move forward as quickly as possible. A lot of times we'll see, and I know every single person on this call has had a renewal that came in late. And I promise you, It just happens every year, and it's not always the same carrier, but it happens. There are glitchy things that happen internally at carriers all the time. So the broker really wants to get that out to you as quickly as possible. That's not something that we would sit on deliberately. So we would like to go ahead and get the decisions, go ahead and get the open enrollment materials and supplies together for you, get the presentation created, whatever the requirements are for your group. So quick decisions, quick turnarounds are really, really important. The other thing is that when it comes to the day of open enrollment, especially if you have an in-person meeting, it's really important to have the meeting held in a place that is a good size for the group that you're expecting, and to really create an expectation for the teams that they should all be present at that enrollment meeting. If you're doing it virtually, obviously with technology, we determined through COVID that we know how to use it and that it can be used on a lot of different ways and platforms. So if you're having a virtual meeting and you can record it, that is always a great option. That way people can go back and look at it at their leisure.
Yeah, perfect. And I'm assuming if you have any kind of enrollment packages, materials, those are great to hand out as well. So we as employers can have them handy.
Absolutely.
Yeah. So now that we're talking about meetings, which is probably everybody's favorite topic, and I say that very ironically, how long should these like preparations meetings be? Like how long, how often? What should be the main topics of discussion for these like office I guess for these meetings as far as preparation for the open enrollment and for the benefits that are going to be offered?
Great question. So a good cadence for that is going to be a strategy meeting about mid-year, and then a pre-renewal. We generally either get on a phone call or meet in person, depending on where our clients are and what their preferences are. We'll meet with them about 4 weeks, 6 weeks before the renewal is released. Talk about what's happening in the plan. Has anything changed since we had our strategy discussion? Is there anything on fire that we need to address before open enrollment? And then sort of set the stage for whether or not we have claims. If we have claims, then we have our financial analysts sort of model out what does the renewal possibly look like, and go ahead and try to budget as closely as we can for that. If there aren't any claims, then we can talk about trend. We can talk about things that are going on that we're aware of and plan accordingly. So that meeting generally takes about 45 minutes or so. And then once the renewal is released, we will typically let the client know, hey, the renewal is out. Here's what it is. We've asked for a no shop, or do you want us to ask for a no shop, or do you want us to shop it based on our conversation? So the timing of those meetings at increments that make sense in terms of when that renewal gets released and how long they should last is really dependent on how much content there is in the discussion.
Okay. And I vote for no 5-hour meetings.
No, not at all. Not at all. So we generally try to wrap those things up. We know that time is of the essence for every single person on this call. So we want to take as little time as possible and be really prepared, have an agenda, have all of our materials outlined, and share those materials oftentimes before the meeting so the client has a moment to review them and they're not surprised by anything.
Yeah. And be intentional, right? Like, what are the topics that we're going to talk about in this meeting? And I remember when we started planning for this webinar, you mentioned having after hours. So if there are those employees that have like those random worst case scenario type of questions, then to plan an after hours meeting for those type of things. Can you talk a little bit about that?
Absolutely. So we generally will do office hours for employees who don't necessarily want to ask questions about, does the plan cover this, or how would this be handled, that sort of thing. So a lot of times people will have questions about their prescription coverage. They'll have questions about network coverage, about the way the claims are handled, and are these types of tests covered, and that kind of thing. And they don't necessarily want to bring attention to that in the group meeting. So we'll often have office hours where the account executives make themselves available during a certain period of time. The employee can either come and visit with them if they're on site, or we can do it telephonically if that's preferred, and they can just make an appointment and have that conversation in private.
Hey, Donna, there's a question here. Before I ask it, though, I know whenever I go to my doctor now, he starts by saying, okay, where's the list of questions your wife wanted you to ask me today? So it's got as much to do with that. what does the spouse want to ask, right? Okay, the
Yes.
question though is a little bit different, but backing up a little bit. So I'll ask two-part question. Number one, generally speaking right now, when is it too late to start considering other options if you're a January 1st enrollment? And the second part of that question is, if you also are on a PEO now and are leaving, let's do the first one first. I want to shop it around now. And it's September the 12th right now. Is it too late?
No. So that's a great question. So generally speaking, renewals are released about 75 days before the effective date. So sometimes more than that, if you're a larger group, sometimes it comes out 90 days earlier. Sometimes you can even get it earlier than that if it's a very large self-funded group. Now, if you're a fully insured or a level funded, you're probably looking at 75 days. If you want to shop it out, you're going to need that renewal before you can shop it out and get any quotes, because those other carriers want to see what the incumbent carrier is offering.
So what is that? 75 days? That would be
So probably 60 days or so. So say it's you get the broker gets the renewal 75 or so days out, shares it with you. You say no go. We want to quote other carriers. You let the broker know probably ahead of time. If you are dissatisfied with the carrier, let that broker know, hey, we're having issues. We definitely want to look at other options. That way they know as soon as that renewal hits that they are marketing that renewal out for you with other carriers.
So it sounds like you've got until about mid-October.
Mid-October.
Yes.
Once you
Yeah.
kind of get past that, you're kind of in a, all right.
Well, you're really creating a difficult situation for yourself and for your broker. And I will tell you regarding January renewals, the bulk of business for every single broker in the United States is December, January. So we probably renew about 65% of our book of business, total book of business in fourth quarter. So the likelihood of things getting backed up and bogged down, falling through the cracks is much greater if you renew that December, January timeframe.
Okay, now add the PEO element to it.
Okay.
We're on a PEO now,
Yes.
and we're thinking about leaving, and it's September 12th.
Do it now. Do it. Here's the thing about the PEO situation. And when you are in a PEO, you want to look at when does your plan renew and when does your contract renew. So it might make sense to do that exit at a different time. I would always say do it on a clean quarter. And if you can do it January 1, from a tax perspective, that is preferred. But if you are in a PEO and you are contemplating leaving, start working on it now. There are a number of things that you will have to do to establish your own presence, such as tax IDs in every state where you have employees. So there are a lot of moving parts with that PEO exit. So we actually have a really comprehensive workbook that we use for our clients to take them through that. So if you're, if that's something that you're interested in, our team can definitely help, but do it now.
Yeah, I've got a board member now going through that, and there's a lot of things to think about in that. The obvious ones: workers' comp insurance, the unemployment accounts, the healthcare, the retirement account. There's all kinds of things to think through.
Yes.
Plus, just depending on your PEO, you have some are more and some are less. Some are more involved in day-to-days.
Right.
Yes.
Handbooks, policy manuals, things like that. So you've got to get those kind of things planned for as well.
Absolutely.
So I guess you in some respects dispelled one myth, and that is you could theoretically enroll in that status quo January, and could you come back in 4 months and change, or do you have to wait till year end?
No, you could change it 4 months if you wanted to.
Right. So you could, since it's already
Not that you want to do that, but Doug, one thing that I'll say about PEOs is some PEOs have started to allow brokers to broker the medical while they're still doing a lot of the HR functions within the PEO and payroll and those administrative functions. So for a smaller company that doesn't really have the infrastructure to manage all those moving parts, the PEO can be a great fit. So, and some of them will allow the broker to stay in the relationship.
Yeah, the other big thing there is your payroll vendor. My board member here, the PEO offer, hey, if you want to leave, fine, but we're happy for you to leave the payroll here. And they called it something like, PEO Lite or ASO, whatever. But their quote for payroll only was $50 per employee per month, 50. And I think you're probably paying 10, 12 or so typically. So I tell I'll say you're paying 4 or 5 times what you would for just payroll. So
Absolutely.
think about that.
Thank you. Thank you for that question. That was
Yep,
really
great
good.
question.
Thank you.
Great.
That actually kind of puts us in the right place to talk about data, right? So if you're thinking about moving from a PEO, or if you're thinking about moving from maybe a fully insured plan to a self-insured plan, or if you're already in a self-insured plan and you're thinking like, maybe I need to shop around, let's talk about data, the good, the bad, and the ugly, like Donna calls it. Donna, tell us a little bit about who reads the data, what type of insight can employers get from this data?
Great question. So if you're fully insured and you have fewer than 50 employees enrolled on the plan, your access to data is 0. There's really not going to be anything that your broker is going to be able to tell you. If you are level funded, you will get some claims reporting. So level funded is kind of a step in the direction of self-insured, but has guardrails in place. So you pay your premiums just like you would if you were fully insured. And then at the end of the year, if you've had a surplus, in other words, you've paid more in premium than you've had in claims, you share in some of that surplus, which can then be applied to the next year's premium. If you leave that carrier, however, you forfeit that surplus. So that's level funded. And because it's level funded and a step into that self-insured direction, you do have access to more information. If you are self-insured, you have access to a great deal of claims and prescription information. Now, you can say to your carrier, I do not want to see any names or identifying data, and they will publish those reports accordingly. If you are accessing that kind of information, you need to make sure that your HIPAA program is locked down, that everybody who has access to that information is credentialed and understands the importance of keeping that information confidential. The best practice, however, is just not to have it. And from an HR perspective, you all can certainly understand why you would not want to know what is specifically going on with individual employees, although sometimes you will. If something were to happen and they were to be dismissed, if there was anything that could be connected back to any knowledge that you had of health conditions, that could be detrimental from an employment practice liability standpoint. So as far as who sees it, you can, if you are level funded, if you have more than 100 employees enrolled on your fully insured plan or you're self-insured, you have access to some reporting. Your broker can get access for you, or you could be able to reach out to your carrier directly if you had a relationship there. Hopefully your broker is the one who's negotiating on your behalf and speaking to the carrier on your behalf. The worst thing in the world is to have to sit on the phone with a carrier on hold for ever how long. So rely on your broker to provide that reporting to you. Now, some brokerages will have a financial person internally who can synthesize that data to make it make sense for you and help you project out your renewals. In that reporting, you'll get to see what your high cost claimant conditions are. You'll get to see how much of it has hit your plan. So how much the claims are. You'll also get to see a drug report that is pretty comprehensive. And that drug report and that claims report can really inform decisions that you're making about other services, vendors you're engaging with, things that you're doing to enhance your employees' experience and to really make the benefits meaningful for them.
So the data is going to tell you a lot about your population and what benefits maybe you need to enrich, or maybe there's some that you can scale back, right? Obviously, you always want to offer the best that you can, but with the data, you'll be able to see, well, maybe we have a lot of really healthy employees, and we don't need as much of prescription coverage, which I know that probably sounds like a total fairy tale, because isn't that like 20-25% of the total cost of insurance or something like that?
Yes.
So I'm a glass half full type of girl. All right, so that's data. Let's talk about technology. So we've talked about you know, the pre-meeting, the meeting, right? Setting up everything as far as data, and if you want to start shopping around, we've spoken about all of that. Let's talk a little bit about technology and the types of admin systems that an employer can use. So what do you think employers look for in their Ben admin technology system, or what should they be looking for?
file feeds. So a lot of Ben admin platforms these days do have file feeds, or at the very least, a sweep where the carriers can access through open API and sweep the data on enrollment every week. So if you're larger and you can have actual EDI feeds, obviously that's optimal. And the reason that we like the feeds is the fewer hands that have to touch the data, the less likely it is that mistakes will occur and that things will fall through the cracks.
Yeah. File feeds are also my best friends. And talk a little bit about who is responsible for setting up that connection, because I think sometimes employers think like, I don't want to think about that. I don't want to learn a new platform. I'll just send an email and copy everyone that needs to be copied in that email. But tell us a little bit about kind of like the back of the kitchen side of the room, I guess.
Absolutely. So most brokers will have access to a platform. A lot of us are using a platform called Employee Navigator now. And some brokers will charge a fee for it. Other brokers provide it as a value-added service to all of their clients. So with Employee Navigator, generally speaking, the broker has a team internally that will set those sites up. Also, if an employer is using something like a payroll platform that has a Ben admin system attached to it, the broker can provide the decisions on the plans that will be on the new enrollment to that vendor so that they can set up the site. So I've only heard of one or two situations where the employer was actually responsible for setting up their own or building their own site, which is something that I feel like most professionals that I know that work in finance and HR have way more to do than to sit down and build a technology suite for their open enrollment. So if that's something that you are doing, you might want to reconsider either the platform that you're using or the broker that you're using, because that's just a really heavy lift. And when that is not what you do, that's not your specialty, there's just too big a risk of things that could go wrong if, one button is not toggled the right way. So
right. Yeah. Leverage your technology where you can.
Absolutely.
For sure. All right, let's talk a little bit about the required annual notices and their delivery. So when we offer benefits, we also have to make sure that the employees, well, first, us as employers, we have a plan document, right, to make sure that everything is specified. And then there are things that we need to give our employees, like the summary plan descriptions of the plans. But there are a ton of other notices, right? So tell us a little bit about what those notices are, what the requirements are for the employers.
Okay, great. So the annual notices are required by ERISA. To your point, the summary plan description is one of them. You also have a CHIPRA notice, you have Medicare Part D notices, you have COBRA notices, and it really depends on the size of the employer as to what notices are required. There are several that are required for everybody. Those notices, it's a good practice to just distribute those at open enrollment. If you do not, there is a per day fine on some of them, and they're all different. So it would really depend on who you are as an employer, which notices you're required to provide, and which notices you didn't provide. So a good practice is to provide those at open enrollment. You can provide them with the open enrollment documentation. So if your broker provides a benefit user guide or something along that line for the employees, you can provide it then. And it's just a good habit to get it into to provide it at open enrollment. Now, there are some notices that have to be provided when an employee enrolls on the plan the first time. So that's a good time to do at new hire. So have a new hire packet that has some of those notices. If you need a list of what those are, reach out. I'm glad to provide a list of what you should be providing. As far as how to deliver them, there are some ERISA delivery rules that say that if everybody in the organization has a company email address, it's perfectly fine to deliver those notices via email. What you want to be able to do is to document that you did provide it. So if you wanted to put a return receipt on it, or if you wanted to just keep a copy of the file where you sent the notices out to the employees, that's perfectly fine. If they do not have email, you can do one of two things. You can physically hand it to them, or you can mail it to your address that they have on file with you.
If you have, let's say, an open enrollment meeting, and you're giving out your benefits booklet, and maybe those are included, is it okay to have a sign-in sheet that
Yeah.
shows like, yes, I'm Martha Barker and I received my booklet and I have all my
Yes.
notices?
Absolutely. It absolutely is.
And how long should employers keep, I guess, like the file or the verification that this was given out to their employees? Is it just for that plan year, or do they need to keep it like 7 years, like all the other types of documents?
As a best practice, I would probably just keep it filed for the duration.
Mhm.
It's something that if you were to have a claim against you, you're going to need to be able to reach back into the archives to pull that out. So I would definitely keep it for the 7 year.
7 year period. Yeah. And then of course, if you can always scan it and keep it in a folder, you don't necessarily have to, like,
Absolutely.
keep the papers. But it is important to keep those type of things. What happens if an employer fails to make them available to their employees? You touched a little bit on it, but not to scare anyone, obviously. But what happens if they forgot, if they're in transition from one HR director or benefits manager to another, and it got missed? What would you say would be best practices on kind of like making sure that that's taken care of, even if it's maybe mid-year or what have you?
So I would say if you are coming into an organization and you cannot find any conclusive evidence that it was distributed at open enrollment, I would get in touch with your broker, get the notices, and distribute them then. I have never in 15 years had an issue with a client having any kind of trouble or fines or anything like that related to not giving out the notices. So it would really be predicated on the employee making a complaint against you for not providing it. So it's pretty unlikely, but it's always good to make sure that you are covered from a compliance perspective.
So when in doubt, send them out.
Yes.
That's a corny joke of today. Especially if you are transitioning into a new position or you're coming into a new company. If you don't see them, it's better to send them out twice, or for people to see them twice than not at all.
Absolutely.
Let's talk a little bit about communication now that we're talking about, the notices and how they need to be sent out. How often should employers communicate the benefits? How often should they talk about, the open enrollment before it happens? Tell us a little bit about that.
It is a good idea to give your employees a heads up as soon as you know what the dates of your employee meetings are going to be. Go ahead and post those if you have a common area in your office. If you have an intranet that you place information on, maybe send out a proactive email to mark people's calendar. Here in our office, a lot of times we will put a hold on people's calendar when we need to bring something like that to their attention. So it's good to communicate it every couple of weeks or so, just to make sure that everybody remembers that this is on the calendar, that we're doing that, and your presence is requested or required, depending on what your company policy is on that. In terms of the communication at the actual meeting, this is where we can really kind of make it fun. If you know who's in your population in terms of, your millennials or your Gen X or your Gen Z, if you know who's there and you know what their communication preferences are, you can begin to push out information based on that. So is it via email? Is it via text? Is it a postcard in the mail at home? That kind of thing. So there are a lot of extra things you can do in terms of setting up a successful open enrollment as far as attendance and engagement is concerned. Now, at the actual meeting, communications are also very important. So the benefit user guide is still a really viable piece that we use, but we're moving away from paper and doing a digital, we call it a flip book. So in the flip book, it's a digital benefit guide, and it has links to how do you use an HSA, for example, or maybe it has a video of the CEO or something like that as an opening of the presentation in the flip book. So there are a lot of more interactive tools and resources that are available now. You just want to make sure that they really speak to who those employees are from a generational perspective.
Yeah. Oh, that's a great idea. I love that. I love the flip book. I keep my benefits notebook at my desk, but if I have a question on PTO or our dental plan or whatever, I always go to the PDF version and I do Control F, dental, and then it shows me whatever it is that I'm looking for instead of flipping it. My dad, though, he prefers to keep his like in his nightstand. So yeah,
Yes.
it depends on where you are in life, whether you prefer Control F or you just really want to, go through all the pages.
Exactly.
So we've talked about goodness, we've covered a lot. So we've talked about the pre-meetings, we've talked about the meetings itself, everything that you need to think about as an employer when you're preparing for your benefits meetings and the benefits that you're going to offer. But of course, we can't forget the post-renewal activities, because you want to not only take off and flight, but you also want to land and land really well, right? So tell us a little bit about what we should consider as employers as far as auditing data and census. What should our post activities should look like?
Great question. So when you're finished with that open enrollment, your broker really is going to take all that enrollment data and communicate it to the carriers. Hopefully your employees have made their elections online, and it's pushed through a feed, and all is well. It's important, though, if you do have access to a platform, a Ben admin platform, or your payroll provider, however you're gathering that data on enrollment, that you just go back through and spot check and make sure that everybody enrolled. And you don't necessarily have to go line by line, because you're not going to necessarily know what they chose, but just to make sure that everyone engaged with the platform. The second most important thing, and this is something that I cannot emphasize enough, once that first that first invoice is sent out to you from the carriers, please go back and double check it and make sure that it's correct. So if you can compare it to a roster, a census that you might be able to pull out of that technology, make sure that your invoice is reflective. There is kind of a grace period, if you will, where if there's something wrong, if somebody didn't get enrolled, that the carriers will work with the broker to make sure that it's corrected. But if it's 6 months down the road, it's a lot harder to get the carriers to do what we need them to do to get those employees on board, and then kind of keep you in the clear as far as a compliance perspective.
Yeah. And you also have to think about those pre-tax contributions,
Yes.
right? So you want to make sure that on that first week or second week or what have you, you're looking at the census data to make sure that everyone that should be enrolled is enrolled, and that those contributions are coming out of pay. Because you obviously don't want to charge someone that shouldn't be enrolled, but you also want to charge that person that should be enrolled. So yeah, good thing to keep in mind. Doug, I see your pretty face. I know you have.
Oh God. Yes, we have a quick question. So when you look at your kind of client base, Donna, over the years, because there's so much energy and work just to be done from a technical standpoint to, get everyone enrolled and get the sheets back and get them signed up and get them in the benefit, all that, all that stuff has to happen. There's, 50 steps or whatnot. What separates the clients that, if you look at those that actually do a very good job of getting high enrollment in the various plans, what's different about them? What are they doing that, or two or three suggestions that can, because at the end of the day, I think this is one of those areas where we spend so much time just getting it done that
Right.
we don't really have time, or forget about what we might do, whether it be to make it fun or whatnot, to get people in these benefits.
Absolutely. Great question. So as a best practice, we have our compliance team has let us know that from an ACA perspective, you need to have an active enrollment, which means that you really, Doug, to answer the question, want the employees to be present. So lean on your broker to provide the information to the employees, whether it's virtual or in person, to provide the materials, but for you to require or strongly suggest that employees are present during that presentation will greatly increase the engagement and enrollments on those plans, especially if there are things like voluntary benefits, like accident, critical illness, hospital insurance, those kinds of things. Those require a little bit more explanation, because they're what you might consider a little more non-traditional. They're not the medical, dental, vision, which pretty much everybody understands. Anything that you're doing on a voluntary basis, you want to make sure that your broker or the carrier rep is present to answer questions, to really provide illustrations. I think we all learn really well by stories. And so a lot of times a story or two will help illustrate how to use the plan and why it might be beneficial for the employees. And Doug, to your point, we always internally make our meetings about food. So food, cookies, those all work really well to get people to the table.
Well, I think also I've seen some employers actively involve the spouses and the partners. You know,
Yes.
bring whoever's on your plan because they're going to have the questions, and
Right.
you know, just trying to get people beyond status quo. There's so much. So everybody's busy, and yeah, we'll just stay where we have now. They don't realize we got this new thing, or what is? I don't know. They mentioned something about wellness. I don't know what it is. You know, well, just never mind.
Yeah.
Or it costs $100
Right.
a month. We're not doing that. They don't hear the pitch. So it could be,
Exactly.
especially with virtual now. How do you get the spouses involved?
It's a great question. So I know you all use a great service called Nurse Navigator, and that is a game changer. So that really allows almost a concierge experience for the employees. And a lot of these types of initiatives can be introduced mid-year. So, you know, there's a lot that's coming at them at the open enrollment meeting. So if you wanted to schedule something mid-year, like a lot of these voluntary benefits, you can enroll those. You don't do those pre-tax, so you can enroll those at any point in time. Give people kind of a minute to breathe, get used to the new deductions if there are changes and what they're paying toward their benefits, and then bring those other pieces in later in the year.
Yeah, we've had staff members tell us their spouses said, "You better not get rid of Nurse Faith."
She's amazing. She really is.
They get used to having someone to call and ask them, you know, all kinds of questions because you know we all know about the doctor experience now. You get your 7.5 minutes or whatnot, so it's just a good place to call. Right.
Right. Well, something like what you guys are doing with Hero Healthcare, to me, that is the wave of the future. So this is giving employees a lot more options that are favorable from a financial perspective in terms of prescriptions, what's available to them at no copay, the doctor interactions that are available for no copay, virtual visits, all of those things that are not financially taxing, but that do require a little bit more engagement and education for the employees. So I think it's a really good practice to periodically through the year, just send out a reminder to say, hey, we have this. And a lot of those vendors will give you an ROI report so you can see how many interactions there have been. And if you hear something from an employee where they've said, hey, we really like this a lot, share that, ask them their permission to share that with the other employees.
Yeah, it's so important how, and maybe we don't see it very often, but how peers can influence other peers. So if you have people that really love whatever benefit you're offering, let's say it's a nutrition benefit or a PEO benefit, or you know, your health insurance like Hero for us, like Nurse Faith, the best thing to do is to have them share. Obviously, you don't want them to share any details, but just how happy they are with the benefits that are being offered.
Absolutely.
Yeah, thank you for that. I run out of questions, so thank you for this time. Thank you for allowing us to kind of like pick your brain, and you're such a, you know, of course, reliable, abundant book of knowledge. So thank you for letting us kind of have this time and really understand a little bit more about what maybe we think we know, but maybe we don't know all the details. So thank you, Donna. We really appreciate it.
You're very welcome. It was my pleasure. And I thank you very much for the opportunity to speak to you today.
Okay, I'll just pause for a second. Questions. We've had several here, but we got a few minutes now. I think we can go for another 10 minutes or so if we need to. So there's never a problem getting out early, I realize. But anyone have any questions?
Yeah, there's one on the chat from Sarah. She said, Donna mentioned a list for new hires, etc. How can we get that list?
If you all want to reach out to Catapult and let them know what you need, and I'll get it for you.
And I'll put my email address on the chat. So if anybody's looking for information for Hub or from Hub or Donna, just let me know. Putting it right now.
Let's see here. I don't see any other questions right now. Okay, again, as we talk about a lot of times when you try to hire a new employee, right? You really got to make sure you court the the spouse, partner, significant other, et cetera. So this is we just forget about that a lot of times, but this is one that they're going to have more questions, especially if for your male employees.
Yeah.
They're not going to know what to ask.
That's very
And so
true.
you want to make sure that you're somehow involving outreach. Okay, now we're getting all kinds of questions. Good. Let's see here. What is the typical length to use for employees to enroll? I guess just the timing.
Yeah, great question. So generally speaking, we would see it be anywhere from 5 to 10 days as an average. There are some companies that will give 2 weeks, but what we see is that the people who enroll quickly, and the ones who don't are going to wait till the last day, whatever the last day is. So, and depending on how quickly your renewal was processed and how far ahead of the game you are, you want to make sure that you have everything put to bed by around the 5th or 10th of the month prior to the effective date. So if you've got plenty of time, you can give plenty of time. If you don't, then I would let your broker probably guide you a little bit on how long that period should stay open.
I like the idea of stories. That's a good idea, because people just, when it comes to healthcare, they don't, unless they've got something going on right then, it's hard sometimes for them to put themselves in that situation. Another question here was, I heard that medical costs are going up or going to increase 7% in 24. Any insight?
That is the same thing that I've heard. So there's a medical trend that can vary slightly between carriers, but it's generally about the same. So this year, what we're seeing is somewhere between 6 and 10%. So that trend is just going to be added on to every renewal and right out of the gate. So if you are a larger group that has some experience in claims, and you've had a really good year, you might not see an increase quite that much. On the other side of that, if you have had a difficult year, it may be, it's not going to be terribly different probably than what you have seen in the last year or two. What we're starting to see from an ancillary standpoint is that ancillaries are coming in. So your dental, vision, life, disability are coming in a little bit flatter this year, because I felt like we had a little bit of a bump in claims coming off of COVID. So that's starting to kind of level out a little bit. So what you're seeing now is a little bit more of the normal, less volatile renewals that we've seen in the last few years.
Yes. There's a question about learning more about the nurse option. I'm happy to send you something, Karen, about how we do that. Then we can maybe take it from there, so we can get you hooked up with Hub or someone like that. It's called Nurse Navigators. They work with any kind of plan. We happen to be self-funded, which makes it a little bit easier, I think. But the tenet of that is, think about what was that commercial when you kind of call Peggy, was it the cable company commercial where you're trying to call customer service and you get somebody over in some foreign country, and it's this notion that the employees just don't like to engage these carriers helplines and whatnot. It's somebody somewhere else. So these actually are real nurses who can actually help them find a doctor, give them scores for doctors, like, where's the best cardiologist in my area. My daughter just had her first baby, and she's still on my plan for now, getting ready to leave it. But just calling about, what does this test result mean? What does this help me find the best, obstetrician, the best pediatrician, all that kind of stuff. So it's really good service, particularly if you have employees that don't like what 1-800 number they're used to with the carrier. Other questions? I think we might have gotten through them. So again, Donna, as always, thank you so much.
You are very
Martha, saying thank you as well. It's been a great presentation. Again, we do these thinking differently once a month. I think there's some slide I'm supposed to look at here, Joni, isn't there? I don't see it, about some upcoming events. Yes. If you want more on Total Rewards, we're actually in Charlotte tomorrow for our Total Rewards conference. We'll be in Charlotte, November, for learning and development. These are focused conferences around these topics: Total Rewards, learning and development. We've got one in Raleigh, 2 in Raleigh, September, optimizing HR, and then recruiting. So we're bringing a lot of outside speakers to talk about these topics. These are kind of mini conferences, if you will. I'm very excited that we're bringing back our big conference next year. That's going to be announced soon. I think I'm supposed to keep my mouth shut about that, but it's coming. It'll be in the first half of the year. I can say that, I think. I think you're going to be very excited, at least those of you who are used to that with CAI. It's going to be a 2-day, bring in some really national thought leaders into our area. So excited about that. We also have these Ask Me Anything webinars that we're running in October and September, just around anything, benefits, compensation, HR, background checks, recruiting. So just trying to get information out there. So again, we will send you an email with the HRCI credits for today. The recording link will be out there. Obviously, there were not slides per se, so there's not really a PDF of this. Again, if you have any questions for us, for Donna, you want to reach Donna, reach Hub, email us, email Martha. We're happy to get you connected with them. If you need anything else, please call us. With that, I'm going to say, believe it or not, it's mid-September, and if you're not already preparing for open enrollment, it's time to get ready. Have a great, I guess, rest of the year, and we'll talk to you down the line. Thank you.
Thank you all.
Thank you all.
Take care.